I'll be focusing a little bit about talking how obstructive sleep apnea affects, almost every major body system, how it affects people's lives on a daily basis in terms of job performance, accident risks, as well as overall financially and socioeconomically.
He texted me here a couple months ago and he said, my wife woke me up 3 times last night to see if I was still alive because I was silent.
I'm going to cover in the adult section some non-surgical opportunities with removable expanders followed by aligners and also just aligners alone.
Shed any negative light on any particular people or groups. That's not my point. I think it's important for everyone to understand the challenges that we face because we feel this resistance, we sense this resistance, but we don't always know why or where it's really coming from.
All right, good evening, everyone, and welcome to our special AHS Conversation series, Airway Palooza 2025. It's the preview and panel discussion. I'm Lauren Gates, your host, and I'll be moderating tonight's session. So Airway Palooza is happening exactly 1 month from today, October 17th and 18th, 2025, at the Westin in Fort Lauderdale. It's our biggest event yet, and it's bringing together leading experts in dentistry, medicine, allied health experts to focus on a powerful theme, and that's moving from downstream treatment to upstream prevention. So we're going to have a great panel discussion on that topic after we kind of review what we'll be speaking about at Palooza. But just seeing everyone's faces all together, I already know it is going to be an amazing event, and there'll be so many pearls to come out of it, and we're really going to make a difference. So we're going to keep this somewhat interactive. We can have actually, you can use the question and answer panel if you have specific questions. And if you'd like to learn more about Airway Palooza while we're speaking, you can go to airwaypalooza.com. So just some housekeeping items, and then we'll go right to it. To receive your CE certificate, you must be in attendance for the entire program. Zoom software tracks attendance, so we do not need a code or a survey. And here is a few disclaimer and housekeeping items. The views presented are the opinions of our speaker and are not necessarily affiliated with Lauren Gates and Associates and Airway Health Solutions. The following webinar is provided for educational, informational purposes only and does not constitute providing medical advice or professional services. We're also having a raffle at the end, so we're going to give away 50% off of our ticket to Palooza, or you can have an on-demand ticket, so stay tuned for that. And we can also hear about upcoming events from these esteemed speakers. So I am thrilled to be here. Welcome, everyone. Again, this is just such a star-studded panel, and there's so much information to be shared. So I'm going to go ahead and just share my screen, and we can kind of kick this off. And I'm just going to invite everyone to basically go ahead and when I call upon you, just tell us a little bit about your segment in, say, 2 minutes or less, and then we can actually go ahead and discuss it one by one. So first, let's take a look. And so make sure you can see my screen. Is it full screen?
It is.
Mm-hmm.
Okay, wonderful. That happened on the first try, so we're off to a good start. But I'm so thrilled to have Dr. Ben Moralia, Dr. Michael Gelb, Brittany Sierra Murphy, Dr. Brett Christensen, Dr. Susan Maples, Dr. Kevin Boyd, Dr. Dave McCarty. It's his birthday, by the way, so happy birthday, Dave. Dr. Linda Dean Duru, Dr. Crystal Dean Duru, Dr. Stanley Liu will be joining us with Dr. Simmons. They're together right now. Dr. Umakant Katwa, he cannot be joining us tonight because he's in India, but he gives his regards. Dr. Brian Hockel, Ms. Samantha Weaver, Dr. Reza Movahed, our keynote speaker, Dr. Cleet Kushida, Dr. Steve Carsonson, Dr. Michael Luke, Dr. Loria Nahidis, Dr. James Bronson, and Dr. Jenna Schwibner. So thank you all so much for joining. And I'm going to kick it off. Kind of put you in the hot seat, Dr. Kushida. Let's talk about basically what you're going to be presenting and how this is so important to you in your heart and your mission, and basically just the latest of research that you can share with us in kind of a 2-minute overview, if you would.
Yep. Thank you. So my focus is on the ripple effect of OSA. We know that about 1 billion people are affected worldwide with obstructive sleep apnea. So I'll be focusing a little bit about talking how obstructive sleep apnea affects, almost every major body system, how it affects people's lives on a daily basis in terms of job performance, accident risks, as well as overall financially and socioeconomically. Now, one thing also that we know is that it's a heterogeneous condition. It's comprised of phenotypes or observable characteristics or symptoms, but also endotypes, which are defined by underlying pathophysiologic mechanisms or pathways that sort of drive this disease process. So I'll be talking about the several different phenotypes and endotypes of obstructive sleep apnea, how to recognize them especially. And then lastly, I'll be talking about what we're doing in terms of how we're looking at the future. And one thing is I'm going to highlight is about upper airway ultrasound that we've been doing research on for the past 5 or 6 years. And now we're going to implement it in the practice of sleep medicine at Stanford in order to help guide patients towards appropriate treatment. Because as you might know, there's CPAP, oral appliances, and upper airway surgery. We go in this in detail with our patients, but after this long explanation, we just typically place everyone on CPAP first. So we're hoping that ultrasound will help guide patients toward these various treatments, and also be a collaborative model between sleep specialists, dentists, and sleep surgeons. And then lastly, also we'll be talking a little bit about how these consumable, wearable, nearable, and airable devices sort of fit into the practice of sleep medicine and also help to guide management. So thank you. That's kind of a real quick summary.
We're thrilled to have you, and what an important piece to Palooza. I know Dr. Stanley Liu was saying you spoke together at the World Sleep Conference, and he was really looking forward to having you here in Florida in October. So thank you for sharing, and we can't wait. So thank you so much.
Thank you.
Okay. So Michael, we're going to go to you. So Dr. Michael Gelb, why don't you tell us a little bit about maybe why you chose Alzheimer's, because I know we discussed that maybe at last Palooza a year ago, and why is it so important, you think, to bring to the forefront on this arena for interdisciplinary care?
Well, I think thanks, Lauren. And I'm glad I'm going to hear Dr. Kashida because I missed him in Singapore. So
wonderful.
I look forward to it. So I think, look, it starts with children. We know the prefrontal cortex gets developed. A lot of us have talked about that. And something that I've been talking about from the Lancet study, it appears there's two types. It appears that for some, when you have sleep disordered breathing, it affects the brain. That's the thin boy, the kid with ADD that's running around. And then there's the heavyset child that it's more of a cardiac consequence. But we've known from Chervin, from Bonnick, and other people that anxiety, depression, learning disability, neurocognitive issues, and neurobehavioral issues start in children with the prefrontal cortex. And as we get older, it affects different parts of the brain, like the hippocampus, the temporal lobe, and different parts of the brain. So whether you want to talk about lymphatics and clearing toxins from the brain that's associated with sleep apnea, or we want to talk about glial cells and neuroinflammation, we know that, one of the reasons we sleep is to consolidate memory. And we know that if you're not getting enough stage 3 sleep, deep sleep, it predicts or precedes, and this is about going upstream, which we'll talk about next. In 20 years, you're likely to have signs of cognitive impairment, dementia, and Alzheimer's. So we have a 20-year window where there's no symptoms, where you're just forgetting where you put the keys. And so I love prevention, and I love the fact that I think it's somewhat preventable whether we will eventually get dementia and cognitive impairment and Alzheimer's. People are now talking about hypoxic burden. Some people are talking about oxygen. It kind of makes sense. There's not a lot of research on some of this stuff. So I think it's a very exciting area. I think the brain is the frontier. You can't really get a brain transplant. You could get a heart transplant. You can get stents. There's not a lot of good surgery that we can do in the brain. So I think that it's a precious area, and it's near and dear to me.
And, you think patients wouldn't even put this together when they go to the dentist office, right? They wouldn't be like, well, why are you talking to me about Alzheimer's? So I think it's such a great topic and to bring to the forefront. So thank you for joining us, and we look forward to it. I know Dr. Hockel and Dr. Movahead, they'll be joining us a little bit later, so we'll get back to them. But Dr. Christensen, I know you're chomping at the bit here because you've been really busy those last, I think, like 18 months or so with your MARPE, and then just bridging between non-surgical and surgical expansion in the adults. So why don't you tell us a little bit about what you're going to be talking about and what you've been up to?
Well, everybody that knows me knows that I'm a clinician first, and I'm a what do you call it, a have to be researcher, and I am all about data. And we started doing the MARPE procedure almost a year ago, and I am finishing patients in half the time or a third of the time of what I've done in the past. But what we're doing now with the data that we are collecting and that I will present at the Palooza is not only the volumetric and minimum cross-sectional areas of the nasal passage with the MARPE versus Schwartz appliance on adults, but we're also got CBCT measurements and what you can expect with the MARPE expansion and the nasal floor, the nasal volume. And I'll give you a little preview. I've got a 60-some-odd-year-old patient that did the Schwartz appliance, and he said that it was wonderful, but he just didn't wear it enough to really get the type of expansion that we were hoping out of it. And he texted me here a couple months ago, and he said, my wife woke me up 3 times last night to see if I was still alive because I was silent. And he had severe sleep apnea and now does not have sleep apnea at all. That's a bold statement to say that we have actually cured sleep apnea, and I'm seeing that in multiple patients. Not all. I would love to see it in everybody, but you can't claim that. So my presentation is going to be about data. And I had a patient that told me that what she wanted me to name my thing, which it's not on the thing. She says, your title should be, He Broke My Face and I Liked It. And
It sounds like a Katy Perry song, right?
yeah, but anyway, just the skeletal changes versus the dentoalveolar changes, and we are very rarely ever going to do anything other than skeletal expansion and expanding the nasal floor. So it'll be a lot of clinical, a lot of data, and I think this is going to be the future of sleep apnea and actually correcting versus just trying to treat it. So I'm super excited.
Well, we look forward to the cases and the data. So thank you so much. Okay, Ben, let's talk about what you're going to be sharing as far as non-surgical expansion.
Yeah, in the non-surgical category, this one is in the adult section. I'm going to cover in the adult section some non-surgical opportunities with removable expanders followed by aligners, and also just aligners alone. And so we'll show some cases there. In the pediatric space, we're going to cover children who basically come in with significant symptoms and or histories, and of course, their struggles are related to the jaw growth and development. Then we're going to talk about the expansion and the technique, and of course, in most cases, how quickly the symptoms can be alleviated with the development of the jaws. And then, of course, going through 4 full case studies, we'll share some very nice progress along the way. I am going to add in a little section now because I've been at it for 2 decades. So I'm going to also start showing the older population now, the kids who are 25 to 30 who are coming back with their wisdom teeth in. So I'm going to give you a little bit on follow-up over the years, how the early treatment led to now the 25 and 30-year-olds coming in, and start sharing more about how they all have 32 teeth now. So it'd be nice to start. So I'll throw a whole bunch of Panorexes and some photos in there to share with you. Kids who have the early treatment get 32 teeth. And of course, in that span of time at 25 and 30, I can show how still no symptoms and not taking any medication, which is very nice to have. The medication lists are growing in most of the populations. And of course, if you get in there early and you treat them, you have a pathway to remain off the medication. So happy to share, it'll be fun. I'm looking forward to seeing everybody else more than, presenting. I can't wait to get there and see everybody else.
Well, thank you so much. We look forward to that. And then we have our Mayo power team here, Samantha Weaver and Brittany Murphy. Why don't you guys come off mute and share with us how you're going to be collaborating on this session?
Great. Yeah, I'm going to be looking at kind of a visual timeline around how myofunctional therapy has had this sweeping visibility shift since 2009 in research, starting with Gamara's randomized controlled trial, setting the stage for how myofunctional therapy and its effect on sleep apnea has grown. And since then, through other meta-analyses, reviews, device approvals, kind of looking at the upper airway muscular approach to the treatment of sleep apnea. So that's really going to be the focus of what I'm looking at, which is through the research. And then Brittany.
My role. Well, first, I just want to say I'm super honored to be speaking alongside Samantha. My first myofunctional therapy course I took was with the AOMT, so this is a very big honor for me. So I'm going to pretty much bring that research to life. So I'm going to be sharing a real pediatric and adult case study, before and after photos, so you can see what these changes look like in practice. The kiddo that I'm going to be presenting, he kind of did it all, tongue tie release, expansion. The adult that I'm going to be presenting really only did the myo. She started clear aligner therapy towards the end, but I kind of wanted to just show what the myofunctional therapy itself does. So you're going to see how, improving oral posture, swallowing, breathing, how that translates into healthier jaws, healthier airways, overall function. So I'm really excited to tag team this with Samantha.
Right, we're excited too, and it's such an important component to all of this. So we really appreciate you being there. We look forward to seeing you both on the stage. Stanley Liu will be coming later with Dr. Simmons. So let's. Oh, wait. Okay, good timing. Here they are.
Actually, be good because we've got a few other things. Stanley just arrived here. My office here in Houston, and we've got a few other things we need to attend to. So it'd be great, maybe if we can.
Yeah, absolutely. So we'll go ahead. We're basically doing a 2-minute overview on what you'll be presenting, and we're talking about day 1, the downstream treatment, so then we can do upstream prevention. So Dr. Liu, why don't you tell us about what you'll be speaking and sharing with us at Palooza?
Yeah, thank you. So, while I always say that the best form of sleep surgical treatment is to avoid it, and that's why there's so many of us here who collaborate in that process. When patients really will benefit from surgery, how has the field evolved? And it really has evolved a lot. And so we'll highlight some of the new, it's important to highlight some of the new technological advances, and as well as the integrative nature of sleep surgery. And just want to give a quick shout out to my mentor, Dr. Klee Kushida, who's going to fly all the way from Stanford. And, he's going to talk about a lot of the technological advances as well. So I think it's going to be really awesome to have everybody. I think I'll pass the mic over to Dr. Simmons. And I flew in here because I have it's a cool story to share. I have 3 patients who I firmly believe need the type of sleep study that he performs here. Basically 2 kids and an adult who is on that UARS spectrum. So I'm super appreciative to come in and wire up the patients with him and then fly home. Thank you.
All in a day's work, like Superman, right?
Yeah, the timing is perfect. He just got here. So, all right, I'm Dr. Simmons, and a lot of possible things to talk about, but I'm going to focus in on a study that we just did with the NIH, funded by the NIH, looking at pregnant women, monitoring them throughout the course of pregnancy, looking to identify the onset of sleep apnea. I think that's the future, but that is not isolated. I think that the technology and the methodology that we utilize in that study is something that's going to be extrapolated into other areas of medicine. So I'll touch on wearables and how they're going to get integrated into the technology. But I'm also going to point out what you're not going to see with these newer technologies, because a lot of people get seduced by the new technology and think, oh, it's all going in that direction and you don't need the lab. The labs are outdated. Well, that's totally not true. Everything has its role and everything has its benefits and its disadvantages. So I think it's going to be important for me to point out what you'll be missing if you just rely on portable technology. But anyhow, that's what I'm going to talk about, and look forward to seeing people there in next month. And that, along with have a great music lineup, and getting excited about that. And see you all next month.
Before you go, do you have any idea what your walk-up song is going to be?
My luck. How about Stairway to Heaven?
Yeah, okay. A little slow, but maybe we'll speed it up a little bit. Stanley, did you have a chance to think about that yet?
Not yet, but it'll be something Latin for sure.
Okay, wonderful, wonderful. All right, well, thanks guys for joining. We really appreciate it, and we're really looking forward to paloozing with you. So thank you very much.
Great.
Okay, Dr. Maples, this will be your trifecta. This will be a third year speaking for Palooza. So
I can't believe that. I'm very honored to be part of this
and
group.
you're always my closer. So let's hear what.
Thank you.
What are you
Well,
excited
to me,
talk about?
Airway Palooza is a group of leaders. You know, we've all been to a lot of sleep conferences, and this group is amazing. And we're speaking to a lot of very seasoned and practicing sleep professionals. And what I look at, what I wanted to do with this is to have prompt for some critical conversations that can help move this whole movement forward. I think that if we're looking at trying to back up and look at how do we keep people from falling in the cracks so they don't end up with treatment, what are the conversations we need to be having in our own communities with orthodontists, ENTs, malfunctional therapists, sleep docs, etc. Not the people giving the lectures. Those are really cool people. How about the less cool people, the people in our communities that are not on board with us? And what do we do? How do we have those difficult conversations, and how do we handle those challenges? And I'm going to give a couple of examples. I want this to be sort of in a dialogue forum so we can all have some input, but I also want to then shift to conversations with patients, earning the right to influence them, and how do we break our very patterned behavior of binary yes and no questions, from our health histories to our screening tools to open-ended questions. And what does the literature say about facilitating health change behavior by making that what you might think is a subtle shift, but a very difficult shift for those of us who've learned to just ask a bunch of yes or no questions. And then how do we coach our business team members to speak with people on the telephone to predispose them to what they can expect, and then collect confidential information, especially about children, so we're not speaking in front of children. I've never seen a child who didn't grow into their reputation, and we get some very challenging children to begin with. And I like to really focus on kindness and not having those conversations in front of children. So we'll talk a little bit more about that. And then really coming full circle, how do we convey all the information we gather back to our co-referrals in the community with letter writing consistently, so that we can not only let them know what's going on with their patients, but we can educate them in the process. What I find is that when we look at the literature, our journals are siloed. So we're getting different messages and different information in each of the journals. I also want to look at how do we collect evidence through AI where we can all be on the same page and share with our professionals. So mine is a little less clinical, but I hope that the people practicing this will find it somewhat useful. Wish me luck on that.
Yeah, and it's such an important component to just bring it all together. So we really are looking forward to that. And again, you're our closer on day one. So we love the energy and the content that you bring. So thank you so much.
Thank you.
Okay, Dr. DeLuke, let's talk about what you want to talk about. I kind of gave you free range here and said, let's bring it on home, because you kind of have the heartbeat right now with your doc podcast and all the, what's going on in orthodontics and airway. So what are you going to bring to the table for us?
Yeah, well, thanks, Lauren, and hello, everybody. Yeah, you did, and I actually appreciate that free reign. And I've thought a lot about how I'm going to approach this, and it is going to be somewhat controversial, some of the things that I say, because I have the unique position as board certified orthodontist who was in clinical practice for a long time, has been involved in academia for a long time, but also see things from the holistic, entire patient-centered, airway-focused approach to treatment, of getting caught up in the middle of a lot of different groups. So I'm okay with talking about that. And I get to see what happens behind the scenes in all these ortho groups online. Some of the other people here do as well, but I will open up some of that to you all to see just how the pulse of the orthodontic community is in general. Some of the things that I've been banned from and told I can't say on these groups. because I think it's important for people to know where the profession stands. I'm not going to do it in a way to shed any negative light on any particular people or groups. That's not my point. I think it's important for everyone to understand the challenges that we face because we feel this resistance, we sense this resistance, but we don't always know why or where it's really coming from. So I'm actually going to dig a little deeper in, and Susan alluded to a little bit of this, the psychology and conceptual side of this. Why is this happening? Why do you have so many people in your community who say what you're doing isn't a thing, or there are no data behind what you are doing? And we'll talk about what evidence basis really is and whether what we're doing is any more or less evidence-based than a lot of the things that are done every single day in an orthodontic practice. So we'll draw some of those comparisons as well to help everybody see it. And then on a positive note, we're going to end with talking about what we can do about it, because I'm a big believer that it doesn't do any good we have to highlight the challenges and the problems, but it doesn't do any good to perseverate on them or whine about them, to acknowledge them, and then we have to figure out how to solve them. So we'll talk about some strategies that I'm going to give everybody on how you can have those tough conversations with your colleagues. And that could even be an orthodontist with another orthodontist, or a myofunctional therapist with a pediatric dentist, just to start to speak the same language so that we can start to move this movement forward together instead of being in these separate silos where we're kind of throwing stones at one another just because what the other person's saying doesn't really sound familiar.
Well, speaking of throwing stones, I know that you shared this article. You wanted to kind of, you emailed this to me to kind of share a little bit. Did you want to kind of go through this now of why you shared this and how it relates to Palooza, perhaps?
Yeah, we will. These are direct quotes, with the exception of the one on the lower left of the screen, which is just a bit of a summary. And I'll go into this in detail during the lecture and the presentation. This was in the June edition of the American Journal of Orthodontics and Dental-Facial Orthopedics, which is the lead journal of the orthodontic profession. And it was written, and the gentleman who wrote it, it was a special article, but it was written, and he actually said he was asked to write this article and said it was an editorial, which means it's essentially speaking for the publication. So that is a bit disheartening when you look quickly at some of the quotes that are within this article. And so we're working on some things to maybe try to do to combat that. At the same time, I want to highlight this because I think it's really important to know just how incorrect a lot of the things that you all don't know how much you know about this, right? We don't realize that you've been in this and entrenched in this, and the average practitioner out there doesn't. And I can't tell you, I had residents say to me, well, we said this article and basically disputes everything you've been saying. Yeah, but it's not true. So, we can break it down on both sides. So I'll talk a little bit about this. And in other lectures I give, I won't have time at this presentation, but I do go into some more detail on each of these points and how to counteract them and why they aren't accurate statements. But for the sake of this presentation being it's a little shorter, we'll just kind of highlight them and call out some of what's going on.
Maybe we'll have you on in October because it's orthodontic month, and we'll do a whole conversation on this. That would be
I'd be happy
wonderful.
to. Absolutely.
Okay.
Yep.
All right. We'll circle back on that, but thank you for that. Okay. Dr. Nahidas, we're going to jump to you because Dr. Boyd is not able to join yet. He may be later. So let's talk about this Fix Before 6 and why it's so important as a pediatric dentist and what you're going to be bringing to Palooza.
Yeah, absolutely. I'm so honored to speak because I'm telling everybody that's on. I went to this for the first time last year and it has become one of my favorite. Like, it was so amazing, such a great conference. So I really encourage everyone to come. So Dr. Boyd and I are talking about, and if some of you know Dr. Boyd, most of you on the panel do, he likes to change things at the last minute. So we were even changing the title. It's going to be Start the Fix Before Age 6, because, we're beginning to fix things. Like, we can't fix things. That's the thing we want to make sure we share. It's not just a, one time you get one expander and then we're finished. So what we're talking about is defining early childhood malocclusion and how, when we delay treatment, we're actually increasing complexity of treatment. And then we're talking about how early childhood malocclusion will explain what it is. Like I said what I just said a minute ago, we're comparing it to early childhood caries. So those of us who are dentists, we all learned about early childhood caries, and we can, relate early childhood malocclusion to that, and how it's associated frequently with sleep-related breathing disorders and other associated comorbidities. And then Dr. Kev's really into, I know Dr. Gelb was talking about Alzheimer's disease. So Dr. Kev's, talking more about and learning more about how untreated severe early childhood malocclusion may accelerate the rate of biological aging and increase the risk of age-related diseases later in life, including Alzheimer's disease. So, and it's a lot to talk about as pediatric dentists. Like, actually what we're doing is we're actually hoping to maybe prevent this, or so that we're in a better place later on in life. But I truly believe what we do in early childhood, under 72 months, which is 6 years and under, can help so much in later stages in life, and just setting up these kids for just a healthy life, good sleep, all the things we need for brain development. So, and we see this in our practice, every single day. So I'll be sharing a case, and then Dr. Boyd will be talking a little bit more about the science behind all of, what we're actually doing later on in life for these kids. So looking forward to sharing with everybody, and thanks again for having me.
Yeah. Well, that's almost all the way upstream, but I know we're going to be going to the birth, the first 3 years, treating ages 0 to 3. That was just a good segue, but thank you, Dr. Hayes. We're really excited to hear your presentation with Dr. Boyd. But Dr. Dean Duruz, let's come off mute and let's talk about your presentation. When I heard you at the leadership meeting last year, I knew you had to be on the Palooza stage. So thank you for joining.
Thank you so much. We are so thrilled. We want to say hi to everybody. We're excited to be joining the Airway Palooza alongside my mom, who is a co-presenter with me. Together, we're pediatric dentists, as you said. We co-lead Ashburn Children's Dentistry Womb to Grow Wellness, where we're focusing on guiding the optimal growth and function, and we're starting at birth. And we were asking a bold question, and we want to ask, what if we could spot airway dysfunction before it ever became a diagnosis? So our talk is called Beyond First Latch, Optimizing Oral Function and Airway Health from Birth. We're challenging the idea that common means normal, because what's been normalized, reflux, noisy breathing, feeding struggles, restless sleep, those actually often signal strain and dysfunction, and starting before a child's first milestone of the breast crawl and the functional breastfeeding. And so from that condylar cartilage and the cranial base, birth leaves a mark. And those early imprints shape how a child breathes, feeds, grows, and self-regulates. So we're going to be sharing how we use laser-assisted neuromodulation, neurocranial collaborative care, and intentional guidance of oral function, and how those can radically shift outcomes from the very start. We want to stop managing just the dysfunction. We want to start protecting development. So we can't wait to share more at Palooza. We're excited.
Mm-hmm. We're so excited. It's such an important segment. So thank you for bringing this to light, because a lot of people don't even know they should be looking at 0 to 3-year-olds. So even just that is really putting us on the mark. So thank you so much. Okay, Dr. Bronson, let's talk about your gentle path to expansion, the light wire approach, and what you'll be presenting for us.
Thanks, Lauren. It's great to have a chance to talk to everybody and to see everybody and listen to what their presentations are. Linda and Crystal, close, dear friends, and I'm excited about their 0 to 3 presentation. What I'm going to deal with most of the time is, first of all, there are a lot of myths about light wire appliances and how the functioning is and what they actually do or can't do. So I'm going to dispel a lot of those myths and show how over our last 25 years we've had tremendous benefits in helping children grow. And I want to emphasize the word helping. And this is one of our 4-year-olds that we treated. This is in 1 year, and if you can see how as the crossbite cleared, her neck got straighter, and a lot of other things happened. And I actually have a picture I just got of her in 2025, where she is today, and she's actually a beautiful young lady with beautiful teeth. And she had, after the light wire appliances, I don't want to, and first of all, I want to dispel that myth too. The light wire appliances are part of the approach. Our approach is a holistic approach where we employ other facilitating things, myofunctional therapy, of course, osteopathy, sometimes physical therapy there, and nutritional guidance. There's a lot of things that go into helping a child to grow and help the airway to be as healthy as it can. So it's not just what an appliance can do. And so we're going to talk a little bit about all those things. But it's been a great journey, and I'm looking forward to how it integrates with this great group of people that you have presenting. And so thank you so much for inviting us to be part of it.
Great, thank you. We get so many questions about it that I figured we'd bring you to the center stage. So we're excited for that. I know Dr. Boyd can't join us this evening, but he'll also have another segment on gestational interventions, which is going way upstream as well. But then we always love to talk about the future of pediatric airway health, the advocacy and the action that Dr. Carstensen is taking, working with the ADA. I know, why don't you tell us a little bit about what you'll be speaking about and some updates?
It's so fascinating to hear these experts tell us all the many things that we can do, the many things we can think about, the new information that's out there, but it doesn't really matter unless the kids get better. And so what we have to be able to do is translate that into actual action. And Susan Maples has a wonderful talk on Friday about, the way we communicate. I will selfishly draw your attention to DSP magazine this quarter, because not only do we have a Palooza ad, but I was able to write an article in there about communication, healthcare as a listening exercise. And so I loved writing that article because I'm fascinated by the power of communicating appropriately. So we have these doctors coming to an exciting event, learning all these cool things, but they go back home and the pediatricians around them don't know anything. Their pediatric colleagues don't know anything. The orthodontists don't know anything. So how do they get the message to the people that are dealing with the same client base they have? So not advocacy at the local level. And what I'm going to advocate for is taking your team together and brainstorming. So I'll give some tips about how you can brainstorm as a team to get curious about what can be done in your community to make the message get out there. What connections can you make? What's happening in that individual community that's unique? Because I can't tell them to go to a health fair if there's not a health fair. But if there's 3 of them, if the schools are open, whatever it works for them, I'm going to advocate for them getting out there and finding the message that resonates. We've heard of, getting started at the Fix by 6. We've heard of See It by 3. We've heard of the growth years are the best. We've heard it, good breathing makes a pretty smile. All whatever the phrases are that resonate with that particular team, they can rally around that, brainstorm around that, make actions around that. And I'll finish with a quote that I actually used I have a leadership quote for my team every morning when we start here at the clinic. And the one I chose this morning is from Dale Carnegie, and it says, "Thinking will not overcome fear, but action will. If you want to conquer fear, don't sit home and think about it. Go out and get busy." And so I'll be advocating for people to go out in their communities and get busy. Take the knowledge base that we have. Don't be afraid of what other people don't know, and really make it happen.
Well, how important is that? That's why this is your third Palooza as well, because again, there's great information, but there's a balance of information, and there's the clinical, there's the support, there's just enthusiasm through all the speakers, and then there's action. So really, you'll probably be a panelist as long as we have Palooza, because you're driving this forward. So thank you for Palooza with us 3 times in a row now. So we're really excited.
I didn't know Palooza-ing was a verb.
There we go. It is now. So we're Palooza-ing. Speaking of Palooza-ing, I'm thrilled to have Dr. Jenna Schwibner. She is actually our featured airway dentist at Airway Palooza. She started off, actually, Dr. Jenna, go ahead, you tell your story, because I'm really excited and thrilled to have you on the podium to share kind of your climb from general dentist to airway dentist.
Yeah, so I feel so blessed to be part of this. I'm just looking around at all of you brilliant dentists and doctors, and it's really a dream come true for me to even get to speak with you all. So I'm so excited to be part of Airway Palooza. Airway Health Solutions was where I first learned about this, and Dr. Ben Moralia spoke at a lecture at the Dawson Academy when I was there, thinking that I was a complete dentist. I had done the core curriculum in record speed, and I was ready to go back to my general dental practice that was focused on high-end aesthetics and concierge, older population. I was really loving kind of my journey towards becoming a part-time dentist, full-time mom, and having that work-life balance. And I really kind of felt like I had it all. And then Dr. Morales spoke, and I realized that my whole life was going to change, because as a mother of 3, I was pregnant with my 3rd, and I had a lot of mother guilt about the fact that I could not breastfeed. I had a mastectomy when I was very young, and I knew that that was going to change the growth of my children, but I always thought, hey, the orthodontist will fix it later, and they'll be fine. And sitting there and seeing how breastfeeding and jaw development can affect growth and behavior and just their entire health trajectory. I sat there with the most motivating force in the world, which is mother guilt, and looked at Dr. Ben Morales' CV and said, how do I know or become as close to him as I possibly can? And so when I thought I was taking a pause on continuing education, it only began. And I quickly took as much as I could from AHS and some other things. And I'm in the process of getting my diplomat with the ABDSM, because I treat all ages. And in my small town in Vero Beach, Florida, there's no one else doing this. I'm one of the only doctors, I think, in Florida. And I say that because people travel 3 to 4 hours every single day. And I'm so blessed. But I wish that other dentists were doing it so that my patients had more access of care. So I could be very busy in my practice, but my additional passion is training other doctors and helping them see that if I can do it, you can do it. I'm just a general dentist. I'm a mom. If I can do it, you can. So my presentation's a short one. I'm going to share one of my favorite cases of a child that we transformed his life in really a year and a half. And he was 14 when we started, so older. And he had such amazing results, and his whole family, their life has been changed, and they cried in my office about it. And I'm so blessed because he's not the only one. I could talk for days about all the lives we change. So nothing is as impactful as that. Doing a crown, doing a filling, it just doesn't do it for me anymore. So I'm only doing airway dentistry now 99% of the time. And I'm very blessed for that. And I want to motivate other doctors to do the same, because there needs to be more of me out there. And there's no reason why there shouldn't be, because I'm just a dentist. We can do this. Anyone can do this.
Yeah, just a dentist saving lives every day. So we're really excited. And you actually may have your patient come and share, I think, a testimonial as well, because they're in the area. So we look forward to that if that comes to fruition. And if not,
yeah, I just saw him today at the office, and he's like, I'm ready. I'll be there if you want me to. So I told him I'd talk tonight, but his whole family, they drive 3.5 hours to see me, and I am about 2 hours from where Palooza is. And so they're like, hey, that's way closer than we go to see you. So we'll come and share, because sometimes people see things like, that's not really possible. It would be nice to hear it from Jaden, and to see this amazing man that has grown with my help.
Great. So that's the inspirational piece. So this all comes together, and we're so thrilled to have Dr. Brian Huckle with us. Welcome, Brian. Why don't you tell us a little bit about how you're going to be Palooza-ing, as we just made a new word this evening.
Happy to. Good evening, everyone. It's great to be with you all. Well, just kind of some of the hitting on some of the highlights here. We're going to have, I'm going to be a co-speaker with Dr. Movahead, but some of the things that we're going to be covering are Doobie Brothers, Beatles, Sublime, B-52s, Four Non-Blondes, oh, wait a minute. You wanted to know about our talk, right?
Well, no, let's talk about the home knots.
No, I mean, we're gonna obviously we're gonna have the Pulmonauts Friday night, and we've got a great lineup of great new songs that we're all really excited to be presenting. And We have a keyboard player, John Neerman, who's incredible. It brings a lot to the band. So anyway, I know you'll all enjoy it. I'm just kind of kidding around because I know Jerry mentioned it too. And even though a bunch of us are speakers, we're looking forward to speaking, but we're really looking forward to playing and doing the collaborative Pulmonauts thing. So anyway,
Left brain, right brain thing.
Yeah, exactly. So Reza and I are teaming up to talk about surgical options. And we want to give kind of an overview of some of the most important surgical procedures that can be done. And obviously, MMA is one. And there are things that make MMA successful. So we'll talk about kind of the orthodontic side of things. That's what I'm going to look at, as well as the surgical side. We'll show cases to illustrate where we've done, for example, bicuspid extraction to allow maximum advancement of the jaws. We'll show cases of MME. We think in terms of MME and then MMA. So maxillomandibular expansion would include the generally some kind of a MARPE, implant-assisted maxillary expansion, but then also distraction osteogenesis on the lower arch to get maximum development of the arch size and tongue space. So there are really four things we can do in the airway orthodontic world. Number one, we can make the nasal airway bigger. Number two, we can make the tongue space bigger, the oral cavity bigger. Number three, we can move jaws forward to kind of get some out of the airway, the soft palate and the tongue out of the way of the airway. And as a bare minimum, number four, we can just don't do anything that's going to reduce any of those things. And so what we're talking about surgically here is making more room for the tongue and the mouth, as well as making more room in the nasal cavity, as well as bringing the jaws forward. Because I think the surgical world opens up options that we may not have any other way. So we'll also show total joint cases where the advancement of the mandible was only made possible really by using prosthetic joints. We'll show cases where we've done subapical osteotomy in going in and retracting lower anterior teeth en masse with the whole bony segment so the mandible can be advanced more. And other stuff too, looking at diagnostic things like the DICE, ways that we kind of plan this out and how we coordinate orthodontics and the surgical. So really looking forward to seeing you all and appreciate the time this evening.
And also, Dr. Huckle, you're a patient as well. Are you going to touch upon that from a personal perspective?
We're going to show my case. Yeah.
Okay.
Yeah.
Wow, that's exciting. In fact, your first picture I saw when I first met you, it looks like a completely different person. Much, you've aged like fine wine here, and you're almost as cool as Michael, but we're talking about that. I don't know if you're as cool yet.
It is life-changing. And, too often we just say, oh yeah, but that's for the extreme. Well, how extreme is breathing? How extreme is, cognitive development and Alzheimer's, the things Michael was talking about? There's a lot at stake here. And having gone through it myself, man, once it's in the rearview mirror, it's like way back there and you get to enjoy the benefits of it the rest of your life. So I don't know, if we don't do anything else, I think encouraging people to delve into the surgical orthodontic world, because even like you as a general dentist, Jenna, there's no reason why general dentists can't get enough into ortho to be able to learn to do these cases and allow a star surgeon like Reza to be able to just hit it out of the park for you while you're doing the orthodontics. I mean, he's doing the real hard part, but the collaboration has to be there, and understanding ortho obviously has to be there. But I think we too often discount it. And yeah, having done it myself, I can tell you, and having seen my patients doing it, they have the same experience as me. For the most part, it's just so life-changing for the better.
And you have a conference coming up too. I'm going to let you plug that because it's a great one. And there's great speakers coming to that, I believe.
Two of whom are on the panel here. Yeah, so the AAGO, American Academy of Airway and Anaphylogist Orthopedics, organization's been around since 1970, very heavily influenced by Crozats and light wire appliances. The ALF kind of grew out of the Crozat appliance. So Jim's been very active in that group. Anyway, that our fall meeting will be in Savannah, Georgia, coming up a week from today. It starts with Darren Ward talking about Crozats in the morning. Then we're going to do fun touring around, kind of team building, kind of socializing events around town in Savannah Wednesday afternoon. I've got it backward. Those are all Thursday, a week from tomorrow. Friday and Saturday will be Dania Tanimi, who I first heard about from Steve Carstensen a couple years ago. And we have her for a full day talking about CBCT analyses and understanding. And then we have the renowned Linda and Crystal Dean DeRue for a day talking about what they talk about. So if you've ever had just a little taste of them, you got to come hear them for the whole day in Savannah. Thank you for letting me mention that. And aago.com is where you learn about it.
Wonderful. You can't learn too much. And Dr. Carstensen, you were saying that Dr. Nahadas, you're a speaker at the ADA conference coming up. Why don't we just talk a little bit about that too? Because just having this on site and on the topic is really a milestone in our movement. And Dr. Carstensen, why don't you fill everyone in on the last ADA conference that you just had this past summer?
Sure, because Gloria was there too. The Children's Airway Conference in Chicago was our 8th one, and I'm very happy it's ongoing. We're just fighting with ADA for next year, but that's not because of the conference, it's because of ADA. But we had amazing speakers there, and guest there was the president of the current president of the AAO came in to hear what was going on. So that was excellent. And we had a physician come up who's a gastro pulmonologist. Didn't even know that existed, but he's very interested in our field. And so we're attracting folks that are knowing that children's airway is something that's critical. So this year was about communication. That's a growth thing I'm focusing on these days. And of course, Dr. Nahadas, hit it out of the park doing that. And all of our speakers were excellent. Lauren, you don't know about another one I'd like to say a little bit about. Eric Phelps, who's a rising star in orthodontic world as well, kind of like Mike DeLuke, but quieter and not as well built, is on the West Coast, and he's putting together a guiding document kind of group on October 17th, and then followed by a CE course from the American Academy of Craniofacial Pain for 2 days. So it's about growth and development and establishing benchmarks and things like that too. So there's a whole bunch of education available out there. And so whether you're East Coast or West Coast, I don't want to draw anything away from Palooza because it's going to be the most fun. Of all the meetings I'll be at this year, that one's going to by far be the most fun.
Thank you for that. And Dr. Nahadas, tell us about what you'll be speaking about the ADA in December, I believe.
Yeah, so actually in October, it'll be the weekend after. So I was thinking I'll have a nice tan for the
there you go.
conference. But yeah, they asked me to speak about pediatric growth and development and things that we can look for really early. So I was really honored that they asked for me to talk about this. And then also about tongue ties, since I'm an affiliate of the Breathe Institute. And I see a lot of kiddos and just how the process, and it's not just a single, like a lot of people buy a laser and they think, oh, let's just release the tongue tie and that's it. But there's so much more that goes into it before and afterwards. So I'm talking more about that. So really excited to share more and just spread the word like we're doing at Palooza.
I just wanted to raise awareness that this is really Airways taking a flight, so to speak. So this movement is working, and it's from all these people on this panelist and all the different groups that are advocating this. So kudos to everyone for really bringing this movement forward. But I would like to ask the panelists a couple of questions that I hear often, and maybe we can kind of just go around the horn and see if everyone has similar or what the answers are. What are the top, say, 1 to 2 red flags providers need to recognize earlier in children and adults? So depending on who you see, why don't you give us maybe just top of your head, the top 1 to 2 red flags? And Dr. Scribner, I'm going to start with you just because it's the Brady Bunch box here and it's easy for me to go in the circle here.
Snoring and mouth breathing.
Okay. Dr. Nahadas?
I mean, I would say the same thing if they're in speech therapy for a long time and mouth breathing.
Dr. Moralia?
Yeah, mouth breathing day or night, wildly unhealthy.
Dr. Bronson?
Yeah, the kids that have ants in their pants, so they can't settle down and they require, extra sleep. And so I think that they're the ones that we have to focus on they stick out.
Dr. DeLuke, maybe not the 1 or 2. We can touch upon some other red flags too. Maybe that we'll do the top 10 here. You're just on mute. You're on mute.
Posturally, I think is big. Looking at their posture, especially their neck posture, and the C-spine curvature. We don't look a lot at that. And then just signs on the face. What does their face look like? And I love the way looking at the eyes. The eyes tell you a ton about that patient's overall health and well-being.
Thank you. Dr. Maples?
I was going to say eyes too, but I really think malfunctional disorders, it's nice to have my hygienists all trained in mile, so even if they're not practicing it, so we can all recognize what is proper function and how does function have an impact on form. And when you see these malformations, you're often looking further like what's causing it and what needs to change here. So I think the mile piece.
Dr. Gell?
Yeah, I mean, I was going to say retrognathia, start looking at the lower jaw as well. I agree with everyone else with the mouth breathing, but also that it starts early with feeding issues, suck, swallow, and breathe. So the earlier we go, and I think a lot of these people, it's the muscles, it's a commonality of swallowing. And so there was a lot said about the swallow, as the gateway. And most of these kids with swallow issues have breathing issues. So there's a lot of ways of picking this up early, and it's collaborating with the OTs and some of the other colleagues, SLPs that don't even know what myofunctional therapy really is.
And what about in adults? Could you see it mostly adults? What would you say the 1 to 2 red flags are in adults?
The big red flag in adults is that it's a hidden problem. And men are in denial, like I always say, and women speak in code. So no one's going to come in and tell you they have an airway problem. So use of the cone beam is very helpful, and you've got to delve into the medical history, and the answers will be there based on the medications they're taking and the medical history. You can kind of tell that they do have an airway problem, even though they will not admit to it, initially.
Dr. Kushida, somehow I skipped over you. My Zoom must have jumped around here. So I'm going to ask you, maybe you can tell us in children and adults what your opinion is.
Yeah, so for kids, there's 2 things. One is ADHD-like symptoms, so attention deficit hyperactivity disorder symptoms, because they manifest the sleepiness differently. And the second thing with kids is falling off the growth curve, because we know that growth hormone is secreted, particularly in the first part of the night. And if the individual has significant sleep apnea, there's a chance that they could fall off the growth curve and not catch up necessarily. And then for adults, I would think sleepiness versus fatigue is a big one. For those with sleep apnea, we generally focus more on the sleepiness. And then the other thing is the brain fog, which is becoming more insidious and hard to pick up. But brain fog is another thing that can be affecting the adults as well.
Yeah. Brittany, what do you see from the myofunctional side?
I'm going to speak from myofunctional and hygiene, because I was thinking teeth grinding this whole time, because I know in hygiene school, we're always learning that kids grind their teeth and they grow out of it. And we know that that's not true. And that's one of the easiest things that anybody looking in the mouth can pick up on. So that's going to be my answer. For adults, I think everybody kind of covered it. I don't really have one off the top of my head, but posture in general for everybody, for sure. I mean, you can literally spot them as they're walking into your office in your waiting room before they even get into your operatory.
Dr. Carstensen?
I would say that bad feeding habits, so they can't chew with their mouth closed, is a big red flag. And also if they have bright red gums from mouth breathing or changing oral microbiome, that sets them off on a bad trajectory as well.
Dr. Christensen, how many children do you see a day?
70 to 90.
Oh my goodness.
So
So
I'm trying to hit everything, and then Brittany went and ruined it for me. I have things that nobody's saying. But one of the top ones is teeth grinding, worn teeth, white hairy tongue. Okay, that right there is a classic posterior tongue-tied kid that tongue has never seen the roof of the mouth. Another one is looking at the facial profile nasolabial angle. An obtuse nasolabial angle is a deficient maxilla, which says that we are also deficient mandible, which is a precursor to all of these sleep disordered breathings. Instead of just looking at the mandible, we need to look and see where that maxilla is. Crooked and crowded teeth. And one of my patients today came in with all of these things, and he is a bedwetter, and parents are wondering why. And so, I mean, I have a 99.9% success rate on curing bedwetting. I have one patient that I have not been able to get him to do it, but so there's a lot. I'm super excited for next month. This is going to be amazing.
Thank you. And let's get back to bedwetting after we answer all the answers from all the panelists. So Sam, what do you think about your top red flags, would you say?
Well, I mean, this is going to be so great. I love this dialogue and conversation because I think we're all looking at different aspects, and yet things are compounded in our culture, and we have to look at parents' behaviors and kind of the systemic approach to how to treat what might be a sleep issue. But then we also know that there are addictions that go into our screens and our phones. So the ability to treat a family system is very difficult now when we have these devices that are making parents less aware and less focused. And it shows up with children who are also unfocused for a multitude of the reasons that we've discussed. So I would say the family systems approach is really something to think about where these all come up.
Great perspective. Thank you. Dr. Haukel.
Well, you're not leaving anything for me, but the top ones I look at, the shape of the face, the structure, how the growth has been going, orthodontic issues, crowding in the mouth, not just for teeth, but for the tongue. And then from the behavioral side, my classic questions are, do you get to sleep well, stay asleep well, wake up feeling rested? Has anyone said you snore? And then for the kids, I find it's a really useful thing to say, does he move around a lot in bed? Does he mess up the covers and kick the wall? And if he's in bed with you, kick you all night long? When they just start nodding really big to those questions, I know we hit one.
Thank you. Okay, and Dean Durus, what do you, the little ones? So you're going to be really, the parents are you really communicating with the parents? So tell us a little bit from your perspective.
We go back to what happened during delivery, how the labor was, because then we kind of have an idea how much somatic dysfunction they come out with. And then when they become a little bit older, we're looking at all the things that everybody has mentioned, but also how much of the overlap or vertical overlap they have on their teeth, which means that there's decreased tongue space for them as well. The bedwetting one's a big one. Reflux is a big one. Then you see that erosion in the mouth. And, you know, in dental school, we thought, oh, that was grinding, but, you know, you don't grind with craters on the teeth. So those are mostly reflux showing, acid reflux showing on the teeth. So. But,
let's go back to bedwetting.
Oh, you know what? One thing that most of us have forgotten about is that dark circle under their eyes.
Oh, that's right.
That's a big giveaway. So,
Gloria,
and also asking the kids if they get headaches. Most parents don't know that you know, the kids wake up in the morning and they have headaches, and when you ask them, they say yes, but most parents are not aware, and that's because they have not had a restful night's sleep as well.
Thank you. Just like
Lauren,
Alzheimer's is, I'm sorry, go ahead.
Oh, no, I was just going to say, we never mentioned with adults, the scallop tongue and Mallampati score, the 2-ton gorilla in a 1-ton cage, right? But when I look at Mallampati scores, the CRNAs or the nurse anesthetists or the anesthesiologists who really coined the phrase of looking at the width and the you know, the visual opening of the throat, I have been watching them sitting up, and we're watching them looking at the Mallampati score reclined, And there's nothing in the literature that looks at the AP relationship between the soft palate and the posterior pharynx lying down, which is how they sleep. And I think we need to be able to find some way to measure that, because oftentimes when you're depressing the tongue or looking, you can see physically. I mean, you can use a CBCT, but you can physically see the AP space is so compromised. So those, just looking in the back of the throat is something we hadn't mentioned yet.
Thank you. I'm wondering on your opinion on the bedwetting, everybody, if that is a bridge with the pediatricians. Has anyone had any luck with that? Because that to me seems like such a direct link that you can really establish that camaraderie between the two professions. Anyone have any experience with that? There's a lot of questions about bedwetting that we get and how it relates to the dentist, and then how then can you collaborate with the medical community on that subject? Don't be shy, just come off mute. I know everyone has an opinion.
I started a long time ago asking my own pediatrician. So 20 years ago, my oldest was 5 years old. And sure enough, just at one of the visits, I said, "Hey, Dr. Pete, do you ever do lunch and learn here?" And that was my opening into the pediatric office. So they let me do a lunch and learn. I dragged a screen in there, I dragged a projector in there, and I showed them what we were doing. And I focused on some of the symptoms they probably get asked a lot about. And so I went for the ear infections, the bedwetting, the ear, nose, throat, lung infection, the things they see all day long. What are they triaging over there? It's all these little infection stuff. Well, that plus the bedwetting and the behavior, that lunch and learn was well received. Then they let me do the grand rounds. So right after that, it led to, I was doing quarterly grand rounds for all of the pediatricians. So I had 30 of them on every Tuesday, a quarterly Tuesday. The first of the month was the 1 hour session with all 30 of them. And so it was fantastic. And that was a really nice thing, because they sat, they listened. And it's very hard to deny when you show them the kids, because then you show them the kid, here it is before, here it is after, and here's the parent and their symptom list, and they don't bedwet anymore. And now they don't have any more ear infections. And then you start to treat their kids and or the patients they send, they start sending you. Then when they go back and they say, yeah, I've not had another ear infection since, or I've stopped bedwetting, that's a nice pathway. So don't be afraid to talk to your own pediatrician if that's a good starting point for you. That's what kind of broke it open for me.
Anyone else want to share on that? Because I think that's such a overlooked way to bridge that gap. Dr. Boyd, welcome. Why don't you, before we go into that, why don't you come off mute and just say hello and anything you want to add?
No, I'm sorry, I just got on.
Okay.
So I missed the first part, how to talk to parents or what. I don't know how it started, but
basically we're talking about the 1 or 2 red flags that everyone pretty much got. I think we not exhausted the list, but covered the flags of what they should be looking for to kind of go upstream to prevent airway disorders. So what are the red flags for our listening audience that they can kind of do it in their office? So we just went around the horn and everyone said their top 2 red flags, but we try to balance it all out.
I guess I would always is this, again, as a pediatric dentist, is this a child that is appearing for routine, just moved in from Kansas, and I was told I should see a dentist before age 3. Well, that's good. That's better than age 5. And are they just coming for checkups and cleanings? And how do you broach the whole fact that I'm not just looking for cavities and gum disease, which is important, but airway health? And I think that is kind of a tricky thing to tiptoe into if a parent, there's so much out there on, social media that people kind of know about it. So I think that to me could present the biggest challenge to people who treat kids, and whether you're a specialist or a primary care person, that has to be handled kind of skillfully, and parents are already worried, and now you're giving them something else to worry about. So you don't want to scare them, but I think that's the big challenge that I like to talk about and learn from other people, especially moms. It's female adult caregivers that are usually in pediatric healthcare. You're dealing with moms. Once in a while, dads, and more dads are appearing, but So yeah, I would say that's the one thing I'd like people to think about.
And about collaboration, because that seems to be the key here. Anyone have any advice or pearl that's worked for them to collaborate? I know, Dr. May, you're all successful at this, so maybe just a pearl for those listening. The bedwetting was one route, but what is the bridge that has been successful for you to collaborate in your medical community?
I'll just add in to what Kevin said. You
Sure.
really have to get the parents involved. And I would have them take pictures of the CBCT image on their phones, record what I was showing them, and take that to the physician, because sometimes the physicians, even if you send a letter, and Kevin was generous enough when he was on the show to offer people, and actually, Kevin, I've had a lot of people reach out to me asking for your letter. So I've never told you that, but the communication that you have with them as a professional is super important. That being said, if the parent doesn't fully understand the magnitude of the problem, and you just tell the parent, I mean, you think about it, they're coming to your office dealing with teeth typically for most of us. And we haven't really talked about teeth at all this entire time, which is awesome. And that's why we think differently. That being said, if you just throw this all at the parents, it's overwhelming. It's a lot. And so you have to walk them through it so that they understand it and they feel it. And a lot of times we all know that feeling. You start to ask these questions and they get that look, and you recognize it. Will have equip them to go talk to the physician, because I hear so often people go to the physician, even if we send a letter and referrals and pictures and CBCT images, and the physician says this isn't a thing, or what does the dentist know? So if you empower the parent and the patient, that is really, as Jen alluded to, the empower the mom, the mom focus, the mom drive, that's really strong. So I encourage everybody to really engage their patients in this.
So Lauren, I love that answer. Lauren, I want to focus on the science, and my understanding is just like adults who say, well, I sleep pretty soundly at night, except I wake up 3 or 4 times to urinate. Well, that's not normal, right? Because we give off antidiuretic hormones so that we don't have to urinate through the night. It's not that you wake to pee, it's that you wake and then your bladder fills. And with kids, they don't get out of bed for that. So the whole idea that we focus on what's the explanation for that and how can we help? It's a better night of sleep, which means better neural development, which means, better cognitive ability, which means better focus, better decision making all day long. And the urinary and the nighttime bedwetting is just a symptom.
Thank you.
I'd like
Dr.
to say
Shabir, did you want to
something.
add?
Yeah. Yeah, I need to more successfully try the pediatricians, but I've gone every time with my 3 kids, and I have a great relationship with her. I mean, great, but I'm always like, here, can I talk? Here's some flyers. I'd love to come in. And they're like, sure. They don't. But what I've had great success with are the therapists and the chiropractors in town. I'm in the functional medicine doctors. So, and the homeschool moms. So the people that are looking for a more natural solution, they are researching online, they're finding me, and then I have chiropractors that are referring to me from all over Florida. And I don't know how they know me. And I have friends from all over Florida that say they're like hours away, and they're like, I went to the chiropractor and they told me to see you. And I'm like, I don't know this chiropractor, but the chiropractors really know this stuff, and they're talking about it and they're seeing tension. And then the myofunctional therapists are just amazing because they're doing these great videos online and education, and they're so passionate that people are seeing their TikToks and their videos, and they're going to the therapist for an evaluation, and then that therapist is educating them every single session, and then they're saying, guess what, I have limitations. I can't get the tongue to go to the roof of the mouth because there's no tongue space, or you can't breathe through your nose, so we're not going to do this. So we really need to see an airway dentist. And they come to me from all over. I mean, I have had myofunctional therapists in California refer to me. And I think that's thanks to the Airway Health Locator, right? So the myofunctional therapists look on and then they're treating a patient from Florida virtually. Because sometimes these patients will find, even though we have great myofunctional therapists in Florida, they might find a therapist virtually that is in California. And then that therapist says, well, let me see who's close to you that's an airway dentist. And if they're in Florida, they tend to find me. And so the therapists are just brilliant people, and I'm so grateful for them.
Yeah, great point. Anyone else want to jump in on that? Because collaboration is key, as we know. It cures. I've heard that somewhere. Okay, so I just wanted to say this is a phenomenal group. We thank you so much for your time, and I'm so excited. It actually is a month away today, so it is the countdown. We're almost sold out. Once again, I know we will be sold out. Our room block is close to sold out. I had to fill a couple of extra rooms. So, so if you're thinking about it on the fence, you're going to learn a lot. You're going to have a lot of camaraderie. You're going to be able to speak with the speakers, getting a lot of insights, a lot of guidance. So, if this is your sign, this is your sign. So hopefully you'll join us. We're really grateful to our sponsors as well. If you're interested in sponsoring, there's still some room, but we're really thrilled about the Sunset Nuts Party. That's part of the fund. So that's included in the ticket. It's a top shelf party. It's dinner, it's foods, it's drink. There's going to be a gorgeous sunset. I ordered it specifically for this event. So I guarantee you it'll be there. Dr. Dave McCarty is not nominated. It's his birthday. I just wanted to say happy birthday to him. And also our next conversation will be with Dr. McCann Katwa and Dr. Stanley Liu. That'll be on, what is that date? October 29th. So we're thrilled to do that. And I'm honored to be on the AAPMD webinar. We're going to be talking about airway hygienist, how basically every hygienist is an airway hygienist. You just may not know it yet. So we're going to talk about how to look at your patients differently. And it's also dental hygiene and orthodontic month. So I'm really honored to be featured for that segment. So come join us. And that's it. That's all I'm going to wrap up today. So let me stop sharing my screen here.
Lauren, before you do
Yes.
that, would you go back to the Dave McCarty happy birthday? I want to text him that picture.
Hold on one second. Yes, I'll be happy to. Can you see my screen?
Yep.
Okay. So I have all these different monitors, so it's not as easy as it may seem. There we go. Good?
All right.
Okay. Well, let me stop the share because I want to see all of our faces. Let's take a picture. Let's put this on social media. We're really thrilled. This is going to be an event. We're all learning from each other. Every one of the panelists, I'm so grateful for you for joining us this year. It's going to be a banner event, and we're really looking forward to moving this forward and really going upstream to prevent airway disorders. So thank you all so much. And thank you for all our listeners for your commitment of being here to help your patients breathe, sleep, and thrive. We're really, really grateful for all of you. So as you keep showing up, so will we. Thanks, everyone. And for the panelists, let's join over just on that other Zoom link. It's in the chat if you want to copy and paste it. And hopefully we'll see you all in Florida.